The authors have no relevant financial interest to disclose in this film. When it comes to capsulotomy associated with femtosecond laser-assisted surgery, there were some initial studies which suggested that femtocapsulotomies might in fact be weaker than a manual capsulorhexis. Subsequent literature, however, has demonstrated that it is superior when it comes to precision, reproducibility, and accuracy. It has also been documented that the strength of the femto capsules is comparable to manual capsulorhexis. Having said that, however, even in an experienced hand, femtosecond capsulotomy can still rarely throw a challenge. This video will be highlighting the challenges that may be encountered with femtocapsulotomy and ways in which they can be minimized. One such scenario where these challenges can be encountered is when you have a small pupil. Something that works well in most cases is to cheat the machine a little bit, where you manually increase the measured pupil size and choose the pupil maximize setting when performing the anterior capsulotomy with the femtosecond laser. As you can see, this has been done here just by manually increasing the pupil size just a little bit. And this works well in most cases. But rarely you may have a situation like this. You can see here that there is an overlap between the pupillary margin and the anterior capsule, which indicates that there is a possibility of uncut areas under the pupillary margin. This is why the anterior capsule was stained here, and once the uncut areas are noted, it is extremely important to be very gentle with removing the anterior capsule. It has to be removed as if performing a manual capsulorhexis, and it's important to not pull on the capsule directly. Another scenario where femtocapsulotomy can throw a challenge is in white mature cataracts. Doing a femtocapsulotomy in white cataracts is usually of great benefit because you get a round circular opening which can otherwise sometimes be challenging. Occasionally, however, you might end up with areas of uncut capsule, which is why it's extremely important that you stain the anterior capsule in all cases. Here you have what looks like a well-cut circular capsular opening, but when you're removing the capsule, it is apparent that there are skip areas. In this case as well, there are multiple areas of uncut anterior capsulotomy, and these are being removed manually. It appears that we have a round circular opening, but during the case it is seen that there is posterior extension of the anterior capsule, which leads to drop of nuclear contents. Eyes that have undergone a radial keratotomy in the past are also candidates for trouble in femtocapsulotomy. Here as well, you can see that there are uncut areas of the anterior capsule, and it's extremely important that these are removed as if we were performing a manual capsulorhexis. This is another eye which has undergone radial keratotomy in the past, and you can appreciate that there are areas of uncut anterior capsule. This is removed by performing a manual capsulorhexis-like maneuver in the uncut areas. Subsequently, you have a round circular capsular opening, but during the surgery, a peripheral and a posterior extension is noted with a posterior capsular tear. Therefore, it's important to be aware of these potential challenges And when removing the anterior capsule in femto laser surgery, it is important not to pull on the anterior capsule, assuming it to be cut fully. It is always possible that there are uncut tags of the anterior capsule, which is why it should always be removed as if we were performing a manual capsulorhexis. This prevents peripheral extension and minimizes the chance of complications. You can see here as well that the anterior capsule is being removed as if a manual capsulorhexis is being performed. This way, in case there are uncut areas, the chances of extension peripherally are minimized. Hydrodissection is another important step where care needs to be taken in femtosecond laser-assisted surgery. It's important to perform a gentle rock and roll maneuver to release the air bubbles that are often trapped posteriorly, followed by performing a gentle hydrodissection. And finally, it's important that nuclear rotation is ensured in all of these cases. Thank you.